Our last speaker of the day, but not the least, is Hamsa Bastani. She's an assistant professor at the Wharton School at Penn, and she will tell us about her fascinating work in healthcare.
I don't know about fascinating, but I'll try to entertain you guys because this is the last hour, so thanks for coming back. This is joint work with a lot of people. I'll highlight Osbert at Penn and Angel Chung at who's my PhD student at Wharton, who have been doing a lot of the technical work. But we've been very reliant on a bunch of folks from MacroEyes, which is a startup that Angel and I both consult at. So Vahid is a data scientist there. Musa is actually our boots on the ground in Sierra Leone, which is where all of this is being implemented. Ashley Schmidt is a deployment manager, and Lauren Sandy is the head of the National Medical Supplies Agency in the Sierra Leone. So he's the big boss that we report to. So I'll be talking about basically the problem that we have is how do we distribute essential medicines in Sierra Leone given a very limited inventory. So on a quarterly basis, Sierra Leone, which is one of the poorest countries in the world, actually gets a limited inventory from organizations like USAID on essential medicines like amoxicillin or Jadel. So there are about 100 plus essential medicines, and they're tasked with sort of distributing them across the 1,000 plus health facilities that they have. So these points here are health facilities, and they're actually colored by the type of facility, but of course I didn't put a legend in there. Basically, these might be hospitals, district medical stores, you know, what have you. And already you can see kind of, this is the capital of Sierra Leone, which is Freetown, and you can see there's a very high density of points here. And then as we go to the northern regions, which are even more impoverished than sort of your average Sierra Leone population, things become even more scattered. You can see low density, so a lot of equity concerns here, which we're hoping to look at soon. So the problem is basically that there's highly uncertain demand and you have very limited budgets. And so a lot of the needs are not being fulfilled. Yes.
What is population density like? Like those empty areas at the top, do people live there, or is it just, okay.
Yeah, it's very hard to measure population density in Sierra Leone because the census is kind of suspect. So we're in the process of getting that data. If you look at night lights of satellite data, it's basically very dark, except at Freetown. But there are definitely people living here, which Musa tells us. So, you know, there is quite a lot of population in the provinces, but most of the population is concentrated here, but they have more access to resources. But great question. Other questions before I... Cool. So the goal is kind of generally like, oh, can we, you know, use like machine learning and optimization to do better? And hopefully the answer is yes. If not, that would be sad. And so let me tell you a little bit about what they're doing right now. And so like how we can improve upon this, right? So the current approach is basically each of these health facilities will put in a request, which is a 3-month rolling average of their demand. So I will say already this is very problematic because there's a lot of missing data, especially in the more impoverished regions. And so how you take this rolling average is sort of very, very sensitive. But then once you do this, they actually plug this into a very complex Excel allocation tool, which if you've taught an MBA course, you've probably seen things like this and told your students not to do it, right? So basically this thing has like 32 different tabs. And the reason is because they started off with some global health-based solution. And then they realized, okay, we actually need to add population and poverty modifiers. So they added tabs for that. And then they decided we should prioritize hospitals over other health facilities. So they added more decision rules for that. And so you basically have this like conglomeration of decision rules, but they're not really cognizant of what happened before. So we're just adding these rules as we go along without, you know, being realizing what's happening before. And I think Angel, my student, is the only person who completely understands how this tool works because she re-implemented it in Python. And she actually found like 2 serious bugs in that they were referencing the wrong column. Another reason why you should not use Excel to build these tools. And so we're not really competing with a super strong baseline, but I'll tell you that it's still hard to do better. There's more inefficiency that comes out of the fact that they basically have this like 3-step process. So this is where the National Medical Supplies Agency works, again, Freetown. And so they get a bunch of stock. And so we'll see like they'll decide to allocate them between the different types of stores or like hospitals. And then they decide to allocate them across districts or different locations, like macro locations. And then there's yet another human decision maker who then comes in and decides how to allocate it for facilities within the districts, right? And so we're really breaking up this decision process, which again is a source of inefficiency if you're doing optimization, right? So what we were tasked with at Macroize was kind of to say, okay, if we had the ability to rebuild this whole system from scratch, like what would we do, right? Oh, I forgot to mention. So these are 8 essential medicine like focal products that we're looking at. And on the y-axis is the total unfulfilled requests in a representative month. And you can see it's quite high. The average unfulfilled demand across the country is about 42%, right? So we're like in a fairly supply not meeting demand sort of scenario, right? And that's why this problem is interesting. Like in the US, I don't think we have this problem as much. Except for the whole generic drug shortage, which is a whole other thing. Okay, so if we were doing this from scratch, what we would do, we could think about doing predict and optimize, right? So like in the first step, maybe I train a demand prediction model for every health product at every health facility. And then I take those estimates and I plug them into some stochastic optimization problem that is then going to actually make allocations, right? This is a very popular and practical approach. And there's basically been a whole stream of research on end-to-end learning saying this is not really efficient because the predictive model is being trained to minimize mean squared error, which is blind to the fact that it's being plugged into a stochastic optimization problem. So you should somehow train these models to account for the optimization problem. And that's kind of what we'll be looking at as well. Questions, comments? Cool. So let me add a little bit of notation. So like if we're doing learning and optimization, we get a response Y. So this thing is maybe today's demand. I want to compute a decision Z, which is maybe like how much inventory I want to allocate to minimize some like known decision loss, right? So this is the classic problem. And of course, the issue is that I don't actually know why, right? I'm predicting these optimization parameters Y based on some historical covariates like historical demand or something like that. And what modern data science has given us is that this step can be very, very complex and it can be non-differentiable. Let's say if you're using random forest or something like that. So we want to kind of allow large complexity here, but at the same time, we want to make sure that we can optimize this, right? So what would happen in a typical problem? I'll get a training phase where I get some examples or historical data, xi, yi star. I train some function f theta. This could be anything to minimize some loss L tilde. So I won't say what L tilde is for now, but like in a standard workflow, this would be like mean squared error. And then in a testing phase, I would get my new x. I form a prediction f theta of x. This is my predict. And then I stick it into my optimization problem to get z star of y hat because that's what I predicted, and then I optimize, right? And so the key question we'll be talking about is what prediction loss L tilde we should be using in training this prediction problem, right? So if I didn't care about the decision law at all or the optimization problem, I would just use mean squared error, right? So this is what all the data scientists, like I think in practice, currently do. So you look at y hat minus y star squared. If I wanted to be perfectly aware of the optimization loss, then I would say, okay, that's not my loss. My loss is really, the loss of z star of y hat, like the decision I made with y hat, like the objective of that optimization problem, right? And this is really nasty because that z star itself is a minimizer of the optimization loss. This thing is non-convex, flat in lots of places, and highly non-smooth, and you can't really minimize this, which is why people haven't. Right? So our question is going to be how to approximate L tilde. Is this clear? Cool. So originally my intuition, which generally is quite bad, was that if I build a really good predictive model and I stick it into my optimization, that should be as well as I can realistically do. Like, why would I ever want to like change how I train my predictive model because of this optimization problem? And my co-authors had no problem with the intuition, but I did. So I'm going to give you what sort of convinced me that this actually does matter. And this example is actually based on the Sierra Leone setting. So I think this actually happens for us. So imagine that you have two kinds of facilities. like well-stocked facilities, like the ones in Freetown, and then the poorly stocked facilities that are maybe in the north. And my goal is to allocate new inventory to meet demand in the next quarter, right? So now I have this toy example. So basically this is my prior inventory. And then this is sort of the demand I'm going to realize this quarter. And you can see that the true function is kind of piecewise linear. So it's the green line for the poorly stocked facilities, so the ones that have low prior inventory. And then it's a red line for the well-stocked facilities that have this larger inventory, right? And because I don't really know what's going on and this data is kind of noisy, I'm just going to go ahead and fit a linear function, not a piecewise linear function. So I'm going to fit this blue line here. So this blue line is my decision blind kind of model, because it sort of just says, okay, I'm going to fit the best predictive model I can. And you can see it's actually not bad. If I were to visually look at this without showing you the piecewise linear functions, you might actually be fooled to thinking that actually does look kind of linear, like a good fit, right? And now we have a really weird scenario where there's actually no point. This could be pretty bad because the red points here are constructed such that there's actually no point predicting well on them, right? Because they're already well stocked. So in my next quarter, I'm not going to send them any inventory anyway, right? So from a decision-making perspective, predicting well here, like small perturbations here is like, it doesn't matter. I'm still going to send them nothing because they already have the stock they need. But if you look at the teal points, that's not true, right? I'm trying to match supply and demand because I'm in this really limited budget setting. So for every extra unit that I predict, I'm going to send them an extra unit of product. And so I really, really want to nail my demand prediction here. I don't care whether I get my demand right here locally, right? And this is true even as like my sample size goes to infinity. I mean, like this decision blind model, this blue one is going to be like arbitrarily misspecified for the facilities I care about. And so this is always going to be a bad policy, right? Instead, what I could have done is just use this teal line, right? If I just built a local linear model here, I would have been totally fine. Right? Does this make sense? Cool. So stepping back, what are we interested in terms of this like building pipeline? We want something that's like fairly general. So we wanted to be able to interface with like fairly complex data science and convex optimization pipelines. This is important because I'll show you that this is actually a pretty hard data science problem that the data scientist Vahid worked on for like about 6 months. So we can't really touch it too much. And then we also want it to be computationally tractable. So, and by that, I just mean like run within a few hours, and some of the existing work doesn't. And we also want it to be light touch enough that it doesn't significantly alter data science workflows. I'll show you what that means in a minute. Okay. So let me talk about prior work a little bit. So I think Dimitris Bertsimas and Nathan Callis had one of the early works on trying to combine like sort of machine learning and optimization, stochastic optimization specifically. So they basically talked about clustering nearby observations in the X space using CART or LOS to estimate this conditional distribution Y given X, so you can put it in an SAA problem. So this is the case that they don't actually update the predictive model or how the predictive model is trained based on the optimization problem. So this is more about learning this conditional distribution for SAA. What we're interested about is actually being able to get a predictive model that's more tailored for the decision laws, right? And this also turns out to not be computationally tractable beyond like simple models like CART. But Nathan actually came along and wrote a follow-up paper with his student Xiaoji Mao on a more specialized approach that does alter the predictive model and is also more computationally tractable for random forest and stochastic, so for example, average approximation. So this one actually, like the issue is that it's not very general. So basically it needs a one-to-one match between the predictive model and the optimization problem that you're solving. So it's like these news vendor type problems. And what we have is basically a meta learning problem. So we need to learn across multiple facilities and multiple products at the same time. I'll show you that's actually critical to being able to get any predictive accuracy at all. And so we want something that's sort of more general and doesn't fit like a specific problem formula. And also this is also turns out to be not that computationally tractable because every tree split in your random forest requires resolving the optimization problem, which kind of quickly got out of hand in our setting. And then there's this really nice paper by Adam and Paul which basically solves this problem in the case of linear predictions and the LP laws. So I really, really like this paper. If you haven't read it, you should read it. But this strategy is kind of very specific to linear models. They basically offer a surrogate loss function that approximates L tilde quite nicely, even though it's strongly convex. But that wouldn't work for like a random forest or when your uncertainty is in your constraints, which is what we will have. And then finally, Brian Wilder and Milan Tombe have been doing kind of a series of work on being able to back propagate through the decision laws. So this is like somewhat specific, I think, to neural nets or other differential function classes. And you also need to solve the optimization problem at every gradient step. So it's kind of also not computation tractable, but honestly, I don't care about any of these things. To me, like from a practical standpoint, all these methods require you to re-implement like classic machine learning packages. And there is no way we're going to be able to get our data scientists to do that. I mean, they've spent years perfecting, their scikit-learn or TensorFlow skills. And, there's a lot of bells and whistles in these packages that we like can't reasonably re-implement, right? So my whole thing has been like, let's have a really light touch change where we can, slightly alter this predictive loss. Maybe it's not optimal, but it will get us kind of closer to that optimization loss that we care about. Okay. Questions? I'm so thirsty today. I don't know why. Okay, so partly I set this example up to kind of foreshadow like what you might do. So if you looked at this, you probably thought, maybe I should just reweight my data, right? And if you didn't think that, let's pretend you thought that. So let's say that you have these baseline predictions y hat, right? That I'm getting from my blue line here. This is my decision blind model. And I want to basically say, like I was saying, these red dots, these well-stocked facilities, they don't really matter for my optimization loss. These teal triangle points, they really matter for my optimization loss. So if we could just learn which ones are important, then we can, then we're, you're cooking with, what is this saying? Cooking with fire? Yeah. Thank you. We can get weights for these observations based on the importance to improving the decision loss near y hat, right? And I'll show you how to do that. It's actually quite straightforward. You Taylor expand L tilde, and you take the first order term, and that actually basically gives you weights. So I'll show you that in a second. But once you get these weights, it's actually very easy, right? You optimize your weighted loss using any off-the-shelf machine learning package to get decision-aware predictions. So basically, I would give these guys a weight of 1 and these guys a weight of like epsilon or something small, right? And then I'm fine. And then I would get this teal line, and the teal line is actually a pretty good predictor locally. I don't care about how badly I predict over there. Right, that's basically the idea. Cool. So how do we actually get the weights? So we take this L of Z star of Y star, and we Taylor expand around the decision line loss, Y hat. And so this first order, a zeroth order term here is just a constant. We drop it, then we look at this first order term, right? So the first order term has two coefficients. So one is the effect of the prediction on the decision, so like how Y affects Z star. And then the other one is the effect of the decision on the decision loss. So how sensitive is my optimization objective to Z itself, right? And so these two you can kind of think of as weights, because now I have my Y minus Y hat, which is my typical error, right? It's not signed, but I'll get to it in a second. But you have this, this coefficient that doesn't depend on theta or the parameter that I'm actually using to minimize the loss. And so we can rewrite our prediction model objective as this. And basically here I've added these absolute values to make sure that it doesn't, because this thing only holds locally, but there's a reason we square our mean squared error. So as a heuristic, we've just kind of added the absolute values, and then these are kind of the weight. So the magnitude of the weight is what we hope will capture how much this point matters to the loss of Z of Y star, Y hat, right? And so typically you won't be able to compute these gradients analytically. I'll show you that for the Sierra Leone setting, because we have a fairly simple stochastic optimization problem. You can compute them analytically, or at least Osbert can, I couldn't. But in general, you can compute them numerically using like prior work by others, like Stephen Boyd and Zico Coulter. Okay, so what is our strategy? We train an arbitrary decision blind model, F theta of X. We compute gradients through some arbitrary optimization problem using off-the-shelf techniques to get our training data weights. And then we retrain the model with the weighted training data. So any kind of predictive model, like we'll take a vector of weights for the training points. And so this is easy. And then we rerun the optimization problem with plugin estimates, right? So this is really very, very simple, lightweight strategy. So first of all, it's general in that it only requires reweighting the observations. So even if you're doing meta learning or anything complicated, that's totally fine, right? We're not really touching the data. Second of all, it's very computationally tractable because we only run the optimization problem twice, and we only train the predictive model twice. You could do it k times if you felt like you wanted to, but you wouldn't have to do it for every gradient step or every tree split, which is a lot more. And then finally, there's no re-implementation, right? You can just supply these weights very easily. In fact, we did, and our data scientist was happy. So that was our objective function. And this sort of extends straightforwardly to offline reinforcement learning if you were to swap the optimization objective with a cost to go function or something like that. Offline, not online RL. Right? I think that's an interesting open problem. Cool. That's all the math I have before I jump into the actual application. Does anyone have any questions? Okay, so the products that we were looking at before we went to deployment, so there's a little bit of a mismatch here, I'll show you, we basically looked at 8 focal products that they said had like reasonably high quality demand data. And so this was some for children, some for maternal health, and some for family planning. So generally in many countries in Africa, these are the kinds of products that are donated as essential medicines because people want to target, pregnant women and young kids, right? And so the data we source from DHIS2 forms. So like a lot of medical centers, like a lot of this data is still done by hand, but then there's this open source tool that's been adopted by a lot of countries in Africa called the DHIS2, where they actually digitize like health planning data at a monthly level. So we have this from Jan 29 to July 2021. One big challenge is that there's a huge number of missing values. So if you look at early on in the time series, the percentage of missing values is basically 100%, right? So there were forms, but nobody was filling them out. Classic. Kind of like the COVID forms at Penn. And then after some time, like basically the NMSA started yelling at them, Ministry of Health was breathing down the neck. So it started like going down over time. So people were actually filling out the forms, and then it kind of plateaued because the people that, are super stubborn, you're not going to convince them anyway, right? So lots of missing data. I think partly this is a hard problem. And then we also have lots of time series, right? So like every health facility product pair is one time series, right? And so even if we're just looking at the 8 products, so we actually started looking at the full 100 set now, but even if we're just looking at 8 and we're looking at 1,000 facilities, you're talking about like 9,000 plus time series, but each of them only has 18 observations, right? Because we only had 31 months to begin with, and then like half of it is missing, right? So that's not great. But you can see that if you look at some of these smooth time series, there does seem to be like systematic, like cross-facility correlations. This isn't like a very smooth process. So there does seem to be value in kind of doing some forecasting. Right? And so standard time series forecasting with 18 observations is going to do very poorly, like, duh, right? I did not need to tell you that. Okay, so what can you do? You can do meta learning. So like, let's say that you have a time series for one product and one health facility. Well, okay, I can't do anything with that, but I actually have lots of health facilities, 1,000 plus for the same product. So I can kind of try to learn across that. And then on top of that, if I have facility specific fixed effects, well, I have lots of products in each health facility, so maybe I can try to learn along this dimension as well, right? And you can imagine maybe it's like a tensor completion type of problem, right? That actually didn't work that well for us, so we ended up doing a random forest. But the idea is basically that we have a proxy data from other facilities and other products, and we can use this to kind of reduce variance, right? So like if I were training a linear model, if I just insisted on using the data from my target predictive task, I'm going to have a ton of variance. If I throw in data from like other health facilities or products, I'm going to have bias, but less variance. And then this whole idea of meta learning, which is something we've been working on for a while, is to kind of be able to trade off bias and variance and do better, right? And so the way that we did this here was a lot of hand engineering that our data scientists did. So there's like a bunch of lag demands for each product in that facility for the last 10 months, month and year fixed effects, rolling average for the last few months, the variance and facility region and type and stuff like that. So you throw all this in, and after a lot of iteration and imputation and feature cleaning and things like that, we were able to, and the outcome here is that the demand for a product facility pair at like a time t, right? So how did this work? Like, well, if not, we wouldn't have been able to work with the NMSA. So this is the marketing comms plot by Macroice. Obviously, I didn't make it because it's not ggplot. But basically this pink bar here, so on the x-axis, you have the 8 products. The pink bar is the 3-month rolling average forecasting error that they're using after we fixed the bug in their Excel sheet. And then the green bar is kind of the macroized like random forest model. So this is still a decision blind model. This has nothing to do, I haven't even shown you an optimization problem yet. And then this yellow bar is the improvement relative to the pink bar. So this is just like the value of like, you know, data and machine learning or what have you, right? So you can see that it actually improved the demand forecast by about 34 to 59% on a held out test set month. So the NMSA got very excited about that and they were like, cool, we can use machine learning. Let's use it for allocations, right? So this was sort of the in. So now we actually want to do optimization, right? So how do we optimize this? So this is a bare bones stochastic optimization problem. I always emphasize it because people are like, why can't you put in all these other things? And we want to put in other things, but we don't have the data to put in other things. So we're just going with the simplest possible objective, right? So my goal is to make allocations across all n facilities, right? So let's call that AN star. That minimizes some cost. And I'm just going to say the cost is unmet demand. Right. So the first order, there's lots of costs, but the first order cost that I care about is a kid showing up to my health facility and I don't have enough medication to dispense to them. Right. So any demand that I can't meet in this situation is terrible. And so the loss function is going to be, you know, CN, which is what I think the demand is, the sample demand, minus the current inventory SN, minus AN, which is like what I allocated them. And we're going to take a max with respect to 0. So if I overstock, I'm kind of fine with that, except that we have a really stringent budget constraint, right? So there's a fixed budget B saying that the sum of all the ANs has to be less than or equal to B. So if I give something to, you know, Daniel, I can't give it to Irene. And so that sucks, right? Daniel's okay with that. Each facility also cannot hold more than its capacity CN, right? So there's also like storage space, especially for the vaccine problem, there's like refrigeration constraints and things like that we need to think about. Okay, and then I said this is a stochastic optimization problem. How I'm going to draw, we're just doing sample average approximation. So we're going to draw random demands at each facility based on the estimated distribution. Like I told you, we fit a random forest. So we just take for each point, the distribution across the 500 or so trees, we treat that as a distribution. Thoughts, questions?
Dataset and the demand sensor.
Yeah, in our data set is a demand sensor. That is an excellent question. So in principle, theoretically, no, because they're supposed to record everyone who sort of comes in and, you know, needs a medicine and didn't get one, because like this whole 3-month rolling average only makes sense if it's not censored. In practice, I think it is censored, but not perfectly. So we're doing a bunch of things now to try to uncensor it. So like in ops, this would be like inventory management with lost sales or whatever, right? So that is what we're trying to do. But for now, we are just dropping any observations where we believe there is censoring and then hoping that it extrapolates well, and then trying to introduce some optimism basically to correct for that. I think this doesn't matter so much for performance, but it matters a lot for equity. So that's sort of our next goal. And that's an excellent question. Yeah.
With respect to equity, you do treat basically every lost demand the same, right? So yes. In a sense, if you don't like, would there be value in basically saying in some locations, in the well-stocked ones, lost sale is a rare event anyway, so we penalize it less?
Yeah, I think that's very hard to convince a policymaker that one person is worth less than another person. But I think we tried to do this, like Osbert tried using like a C-bar objective so that we do a quantile because we basically have higher uncertainty for these like less poorly stocked places. And weirdly, it actually did worse. So that's something we're still trying to like engineer around with. So I'm not going to pretend that this is anywhere close to the optimal thing that you could be doing. But at least a lot of the simple things that we try, like C-bar, like didn't work that well. But yeah, I agree with you. They're very opposed to reweighting unmet demand, except by facility. So like hospital unmet demand is weighted more than district medical store unmet demand. But because there's this sense that, you know, it's like one country and one people, like what you're taking from one person goes to another person, it has to be like an uncertainty-based argument. But that's a great question. Other thoughts? Cool. So this is an efficient linear program. People know how to do this. Ops 101. Okay. Cool. So why I brought this up was because, like I mentioned, you can actually analytically compute what our weights will end up being in this like very simple optimization problem. And so if you actually do this, like, remember I told you that we're going to minimize a loss where we have like, you know, the absolute value difference of the prediction minus, so there are K, so there's two sums here, the training data and also the scenario that I sampled in. And you can see that the weight actually turns out to be something really intuitive, which is whether the demand actually exceeds, you know, like the inventory plus the allocation. So basically, was this a facility that was understocked, right? So we're basically upweighting training examples that have unmet demand. This is an indicator, but you should really think about it as a probability because like it's over the sample's K. So if you sample over it, you kind of get this like empirical distribution, if you will, right? So it's very intuitive, at least, you know, this is what sort of convinced me at least that this is like not an insane thing to do. So the idea is basically that classic machine learning kind of spends capacity predicting at facilities that have low stock out likelihood because it treats all the training data the same. But, you know, there are some samples that sort of matter more for the decisions that we're making. And so they're relevant to the optimization objective. And so we want to upweight these things, right? And so like, I mean, you've probably seen this in like recommender systems, for example, there's super users and like sparser users. And like, typically, if you just do like collaborative filtering, you don't treat your sparse users well. And so they upweight the sparse users. Here, we're basically learning what those weights should be because given an arbitrary optimization problem, you might not be able to figure it out so cleanly. Okay, how did this work? It actually worked pretty well. To my surprise. So these are the 8 essential medicines that I talked about. Again, these are the ones that have like good data. I'll show you what happened when we went to the ones that have bad data. So the green bar is basically the decision blind unmet demand. So basically all we're doing here is we're training that decision blind random forest, plugging into the optimization problem and getting allocations. And then for the decision aware policy, we basically then do that extra step where we then compute the weights, retrain the random forest using the exact same pipeline and then plug it back into the optimization problem. And here we're looking at unmet demand on a fixed budget on a held out test set month, right? So we basically see the true demands, we fix a policy, and then we see how well we would have done in terms of unmet demand. And you can see that there's systematically like across the board, you get a lot of improvements on the optimization objective. Of course, if you look at mean squared error, you do worse, right? But that was our goal. We care about the optimization objective. And you can see for like products like magnesium sulfate. So the thing about magnesium sulfate, I'm not a physician, but it's basically like a fairly erratic demand pattern. And so this is just something that's like very hard to forecast. And when it's hard to forecast, the improvement from doing the decision aware forecasting is also less. We also tried these on vaccines. So the 3 vaccines they were looking at were BCG, measles, and pentavalent. Here, we also help, but not as much. And that is because for vaccines, the demand pattern is kind of more smooth than essential meds. And so it's just an easier task. As you can see for the y-axis, the unmet demand, like percentages are kind of just much smaller than they normally are for essential meds. Okay, questions before I, yes.
So it seems at least a little bit like fundamentally the problem is actually not as much scarcity of resources, in the sense of like you do have enough resources. It's really about allocation of resources. Is that correct?
Yes, and that's actually by design because they sum up all the demands across locations and that's how they decide how much to donate. So you should imagine that we're always in a situation where the amount that you're getting at NMSA like almost exactly matches how much they think is needed throughout the country. And so any mistakes you make in sending things where they should go are like very detrimental. So absolutely, yeah.
So if I think back to your piecewise linear example from the beginning,
yeah,
I could think, okay, well, if you are training a linear classifier, you have to do the weighting. But if you were training a piecewise linear classifier, you could get away without weighting.
Yes.
Could you get away without weighting with a bigger, badder random forest, or would that have other detrimental effects?
I think so. So I think that's why we don't help as much with vaccines, because like prediction is easy. Whereas for essential medicines, prediction is really, really hard because we have so few observations. So I think you're really hitting the nail on the head, but like my intuition only extends to linear. So I was like, all right, I'm not touching it beyond here. But I think absolutely. So if I had a perfect predictive model, then I wouldn't need to do any weighting, right? Because it would perform well in all regions of the X space. All we're doing is saying some regions of the covariate space matter more, but if you could just get low error everywhere, then you're done, right? So yes, absolutely. Your intuition is spot on. Yeah. Okay. Cool. So then they told us, hey, we should do this for the last quarter of 2022. And we weren't that ready, but we did something. And so this was for, so in gray bars here, basically we see the NMSA's allocation tool. And in the blue bar is basically like what we market as the macroized AI optimizer. And on the x-axis were whatever products they actually had stock for this particular quarter. And you can see that generally you see a lot of gray bars and you don't see that many blue bars. So that's us doing well. We're not getting as much unmet demand. And almost everywhere we actually improve, except for methyl dopa, where we do terribly. So we have 79% unmet demand, and the crappy Excel allocation tool actually had 0% unmet demand. So as with any good engineer, we saw this and we took methyl dopa and threw it out, and we only deployed it for the other products. But basically, this kind of underscores this issue that, like, so like overall, you can reduce about 84% of unmet demand at hospitals and 38. So these are the prioritized facilities, and 38% of unmet demand at the other like district medical store type facilities. But clearly, there's like work left to do in trying to like smooth out these predictive models, right? So random forests are like highly erratic, and so they do really well on average, but like occasionally they're off by like a factor of 100, which is like what happened here. So we're working on, trying to use this tool called catalytic priors that Sam Koo and Don Rubin kind of worked on at Harvard to try to basically use some synthetic data or like population-based data to smooth out these predictions. It's almost like doing empirical based, but like for random forests, so that, like that doesn't happen, right? But at the very least, like it seems promising on other kind of products. And so this is sort of the map for the deployment. Like everybody likes looking at maps and not Excel tools. Don't use Excel, kids. But this is sort of the dashboard. And basically, they can click on it and say like, okay, amoxicillin, this is the projected demand. This is the standard error, yada, yada. And the goal is to kind of not just do this for Sierra Leone, but also deploy it in like Cote d'Ivoire and DRC and so on. So they have similar problems. Like I think in Cote d'Ivoire, they're doing like just the family planning products. And in DRC, they're doing essential medicines also. And so hopefully there's also opportunity to kind of transfer learn across countries, because the DRC has about 10 times the population that Sierra Leone has. So with larger scale is hopefully higher quality data, right? So there's opportunities to kind of learn across. I think there's a lot more exciting questions here than we answered. So like the first one is the one I already mentioned, like how to stabilize predictions for these low data products. So we didn't get a chance to like do that yet, but like some kind of catalytic prior, what Ruben and others are working on, but like in this multitask kind of meta learning setting. And then also like this missing data has been a really tough problem, and it has all these equity implications because they're like systematically missing in more impoverished locations. I think this is like a very important problem, even sort of in the US, like Sandro Molinada and Ziad Obermeyer have written about how, You might have errors in terms of diagnosis or like completeness of the medical record for poor subpopulations. And we have an opportunity to actually collect this information, right? So like you have boots on the ground, you can actually send people to health facilities and ask them like, what was your demand for this product? Just because they didn't fill out the form doesn't mean we can't do anything, right? So this is like an active learning type problem, but you want to do it in a way that like, again, is cognizant of the optimization problem, right? Like, so how do you do this systematically to improve like decision-aware learning or equity objective in this decision-aware learning kind of problem. And then of course, like there's a forward-looking, like I've been talking about this, like it's a one-shot problem. I believe that it actually is just a one-shot problem because there's a lot of waste and theft in these locations. So it's not like inventory perfectly carries over to the next quarter if you over allocate. But in general, you might think of this as a reinforcement learning problem, right? Where you want to be forward-looking as well. And then finally, like these forecasts are actually being used by other organizations other than the Sierra Leone NMSA. So for example, M-Pharma is a company that actually does like stocks pharmaceuticals like in Sierra Leone and other countries like in Africa. And so they actually use these demand forecasts to decide like how much to stock in each store. And so I think in a lot of tech companies, we have the same thing, right? Like where one team is kind of doing machine learning and the other team is kind of using those predictions as a feature or something else inside their decision-making problem. So there's this problem of like, if I don't know the exact optimization problem, but I had some prior on how they're making decisions, I might still want to account for that in my learning problem, right? So I think for any of these health problems, we do want to upweight understocked facilities, right? That feels like a general thing that you probably want to do. So if you could do this more systematically, that would be nice. And then finally, there's this like really exciting human AI interface problem that I have no idea how to answer. But basically, we did all this work so that we can give people some like allocation policy and tell them this is what you should do, right? And then the day of the allocations, there was a flood and some road is actually like non-operational or some driver like didn't actually show up or some truck is missing, right? So they literally cannot operationalize the thing that you told them to do. So now what do? They have some extra stock. They kind of walk around to every truck. They see the first truck that has some space and they just stick it in there, right? And that's not ideal. And so I think this is really our fault. Like we work on these optimization problems and they're not really like interpretable solutions. There's been a lot of talk about making machine learning predictions interpretable, but how do we kind of explain like why we allocated X units of amoxicillin to this health facility so that they can understand, okay, if I can't send it to this place, I should send it to another place, right? I don't know the answer, but if someone does, that would be great. And that's it. Thank you to my collaborators. So again, Osbert, Angel, Vahid, Musa, Ashley, and Dr. Sandy. Thanks, guys. Questions?
Hi, that was great. I have a question about sort of combining the learning problem and the optimization problem. In this case, you had sort of like, a single nice objective, and I'm curious, and this relates to the decision tree making scenarios that you cited at the beginning. Are there actually more like algorithmic decision making processes around these where it's not just about just the single allocation step, but like maybe more complicated steps that you might want to apply this sort of strategy to? I know that makes sense, but just sort of a situation where it's like, if the city or the store has, more than a population of X, then we do A versus B, and just like a more complicated policy scheme where the model could be integrated at like various steps. There's like sort of multiple options for the intervention, even though you have this sort of single model. I feel like it's hard to like fix the optimization problem when the decision-making process is more complicated, if that makes sense, than a single decision.
I think so.
Sorry, that was like, I'm not sure if that was the best worded version of the question.
No, you sound like my boss, so I
sorry.
want to say that
I'm also not your
opinion
boss,
is
so you
very
don't have to-
accurate.
Yeah.
So, okay, the thing that we always get is like, oh, why don't we have a more complex objective where we also throw in like equity and like logistics costs, transportation costs, and complexity for like the drivers. Is that what you mean, that we should have a more?
Not necessarily that, but just in the sense of like, I think there's an assumption that you're just making like a single decision at a fixed point. This is like similar to, I guess, comments that Lydia had made in her talk around just, these decisions and these policies are not just these like single decisions at a fixed point. I think even the talk this morning, when she was talking about like the medical decision-making process, it's like, it's really this decision tree, right? And I think that that's why the prior work was sort of looking at policies in the lens of that. And I'm curious if that's actually something that shows up in this work, or if it is that simple, it is this sort of like very kind of one-time decision. And so you can just turn it into a optimization problem, and you can just like integrate it into, like you can just integrate your loss function into that and it's fine. Or does it actually end up looking more complex when you try to apply things?
I think that's an excellent question. So like ideally we would think about it in terms of like this pipeline or like a reinforcement learning, like long horizon problem. I want to say like, I don't really believe in that in this setting because there's too much uncertainty, right? So they don't even know like how much of a budget they're going to get next quarter. Like we're operating in like these very, very uncertain environments, right? So how do you plan for the future when I'm like not even meeting demand in this quarter? And I have no idea if I'm going to meet demand or whether I'm going to get donations. Like during COVID, like the donation amounts, like, just came down like really largely. And that's kind of why we had this 42% unmet demand number to start with. So I just think I think in the US or like places where you have like, or problems where you have better data, you can think about these longer term interventions. So like in education, like Lydia was talking about, I think it makes sense because we've invested a lot to collect detailed, time series data. I don't think we're here yet. Like they only adopted DHIS2 like 31 months ago. And then like, half of that time, nobody was even filling out the form. And I don't mean that as a criticism. The US did exactly the same thing, just a little bit earlier. And, even here, like in impoverished neighborhoods, we're not doing a great job of doing like integrating AI in medicine. I think partly because we don't have like the good panel data. So I think we want to get there, absolutely, but I unfortunately don't feel like we're there yet. But I think Lydia is smarter than me, so she can definitely chime in.
Oh, hi, thanks for the talk. I had a question on your model. So do you have any assumption on the function class of F? Does it matter?
I don't. So this is a heuristic. We haven't proven anything about it. But I think F can be pretty arbitrary because we're just reweighting the points. I feel like I'm going to get yelled at for saying that, but that is my intuition. We haven't proven any convergence like or results or anything like that, right? But I think that's fine. Yeah.
Thank you.
My question's kind of related to that actually, because I really like the idea of weighting the points, and I was wondering if the main ways it improves over the like predict then optimize approach is when there are subpopulations.
Yes.
Or are there also other like scenarios that don't have to do with subpopulations where that there's an intuition for why that works?
That's a good question. I haven't thought about it. Like I thought of the subpopulation example, and I thought, great. Now there exists at least one example where this is true. But yeah, I think it would have to be that, I mean, I guess it's not necessarily subpopulation, but it has to be that some region of the X, like the covariate space, like matters more for decisions. And I think regions of the covariate space, you can always interpret as subpopulations. So I'm not sure like what would be more general than that.
Right, as in not just like the individual points, but certain subsets of covariates or subsets of features. Yeah.
Right. I think that is what it is.
Generalization. Right? Yeah, that makes sense.
Yeah, because here it's not like we're specifically thinking like, oh, areas in the north need more or need to be upgraded. We're just looking for spaces in the X like feature space, right? Yeah.
Thank you.
Thank you. On, yes, okay. To the point you had on the last slide about sort of like one truck doesn't show up that day and then you have to like reallocate all of that. First of all, very funny. How's like you're like gonna solve all these like optimization problems? It's like, oh, it's like a road is down. But I'm wondering, inspired by that, have you thought about robustness of these results? How it's like, you know, if like one driver doesn't show up, would you in hindsight dramatically like, you know, reallocate all the rest of the stuff on the other trucks, or kind of like, are you still roughly happy with like the rest of the allocation?
I think so. I think like this seems like a very shadow pricey kind of problem, right? Like, okay, so we want to like think about, so it feels like it should be roughly monotonic because like we sent allocations to where they were needed most. And so if you were to take away a little bit of the budget, you would just look at wherever the next highest shadow price is. But then you want to kind of account for the uncertainty in the machine learning model. So maybe it's like a shadow price plus. We haven't done any of this. I didn't know it would be an issue until it happened. So that's just a random
joys of practice.
So it's just a random point that's thrown out there. But I think that's sort of like what would be ideal. I think it's robust enough, like the existing allocation is probably fine, but when you want to add it, you want to do it in a way that's cognizant of what the shadow prices are. Would be my intuition. I don't have answers for any of those things. That's why I said many exciting questions, because I don't know. but yeah. Great questions.
So I have one question. So you take the optimization problem as an input into the learning problem to improve the predictions. Have you thought about closing the loop and saying, can I take something about the predictions and improve my optimizer, maybe the quality of predictions at different points, and see how that entire system of feedback in both directions works?
Oh, that's really interesting. I want to say no. I mean, I guess I thought like because it's a stochastic optimization problem and we're taking into account the uncertainty of the prediction kind of into the objective itself, that we're done. But are you that it handles that? But maybe there's something smarter that one could do. But to first order, we do account for the uncertainty in any given prediction. But I mean, as you're saying that, I also feels like, like if we were to actually then pass that on to health facilities and say like, hey, your data would really help us improve our predictions, that would also be really cool. That would
so this ties into your question about which data do we want
to go after. Yeah. That's a great point. Yeah.
Any other questions? Let's thank Hamsa again.